Other than dealing with dislocations, subluxations, and constant joint pain, one of the most difficult challenges we face as zebras is to get the right treatment due to how many providers we have to see. So I went ahead and asked Michelle Romero, our mayor of Henderson, for a proclamation recognizing May as EDS Awareness Month in the city of Henderson, Nevada. It takes a team of specialists to manage one EDS patient. I myself saw in 2 weeks 10 different doctors in 5 different states, including Dr. Fraser Henderson, my neurosurgeon located in Maryland, who quite literally saved my life from being paralyzed from the neck down due to my EDS by performing a cranial spinal fusion. I also saw Dr. Ann Maitland, who has been helping me manage my compromised immune system and mast cell activation syndrome. She's always great to have in my corner because she has not only studied EDS, but has written literature on it. In Arizona, at the Mayo Clinic, I had an appointment with Dr. Carissa Arca, my autonomic specialist, and Dr. Amal Starling, my neurologist. These two have been there for me for such a long time. The only reason I was able to go to Washington, D.C. for Headache on the Hill was because of Dr. Starling's most recent medication protocol. Dr. Brent P. Goodman also helps me manage my dysautonomia. During my trip to Maryland, I also got to see J.R. Buckland, my physical therapist that helped me after my surgery. I was able to sit in with him and have a session. I've tried so many myofascial therapists and physical therapists in Vegas and other states, and no one comes close to what J.R. can do with his hands at Cornerstone Physical Therapy in Frederick, Maryland. I'm lucky to have met doctors that understand my condition, but there is a lack of education within the medical community about these conditions. Patients are often met with confused MDs who don't know how to treat a patient like us, and the insurance agencies don't believe some of the diagnoses or recommendations for medications, causing us to have to jump through hoops to get through to the proper treatment when it's hard enough to even get diagnosed. And add an extra layer of red tape, you're now dealing with getting your prescription filled across state lines. Another hurdle that many of us experience is struggling to travel this often and this far when we are in constant 24/7 pain. I travel with my neck brace because my head and neck just can't handle the ride. Other people I know use wheelchairs and other mobility aids or braces. I do bring with me my greatest distraction though on every trip, my guitar. It's given me an identity and a purpose along with an escape from reality of the situation I'm in. So again, I would like to thank Michelle Romero for making May EDS Awareness Month. Hopefully with more advocacy like this, we can spread the word far enough to make a difference for approximately 1.4 million people living worldwide with EDS.